Hello, my name is Pat McKenzie. I'm one of the nurses here at the University of Michigan Medical Center Plastic Surgery Clinic. The purpose of this educational video is to help our patients with their post-op care of their JP drain. This is what a JP drain is. Depending on where your surgery is, will determine where the JP drains are. The JP drain white portion will be internal. There will be one black suture that holds the drain in so it does not inadvertently fall out. The ball portion of the drain will collect fluid. It works kind of like a turkey baster. You squeeze the bulb, you plug the hole, and the drain itself provides mild suction to the area. Because post-operatively, fluid can accumulate inside the body. This helps facilitate getting that fluid out and the wound healing better. Now there are calibrations on the bulb that you'll have to hold up at eye level in order to read them. You will be provided with a JP drain instructional sheet in your history and physical packet. The instructions you can also access from our website. The directions are on the sheet telling you how to clean the drain using half peroxide and half normal saline on a Q-tip around the exit site of the drain. That's all you need to do. No cleaning is necessary of the bulb or the tube. This is a closed system, so it is considered sterile. You will need to milk the drain 3 times a day. I recommend that you use a wet washcloth. You will anchor the drain wherever it exits the body, whether it's from the upper breast area or the lower abdomen. You will anchor the drain so it doesn't get pulled out. You will grab with the washcloth and pull down on the drain, just like this. That will move any blood clots or debris that possibly could obstruct the drain down into the bulb. Once you've milked the drain, you'll hold the bulb up to the light. It is calibrated so that you can measure it. You'll look and see how much fluid is in there. You will go to your recording sheet and document that on your recording sheet. Then you'll take the bulb over to the toilet and discard any drainage that's in there in the toilet. At that point, you need to squeeze the bulb first and then seal it in order to provide that mild suction again. Now these drains stay in anywhere from 3 days to a few weeks. It all depends how extensive your surgery is on how long the drains will remain in. When your output is less than 30 milliliters per day per bulb, then you'll need to call our clinic and speak with one of the nurses. We will book you into our clinic day, either the very end of a day or the very next morning, and we'll remove your drains. Know that you do not need to make this appointment on your regular physician scheduled day. You'll only be seeing the nurse on the day that your drains come out. Now, one drain may be ready to come out before another one is. That is not unusual. Some people who maybe live far away prefer to wait until all of their drains are below that 30 milliliter volume before they come in to have the drains removed. Other people choose to have the drains removed one at a time as the volume drops below 30 milliliters. Whatever the case, just call the clinic first and we'll book you into the first available appointment. Here are some frequently asked questions that our patients have about their drains. What will the drainage look like that comes out of my JP drain? Well, initially the drainage will be bloody. After a couple of days, that drainage will turn into a transparent red color, kind of like cherry Kool-Aid. Then it will progress to an amber, kind of apple juice color. So that's the sequence of events. Bloody, kind of transparent red, and then amber. If for any reason you go through all of these steps and then the drainage goes back to the bloody, that would be a reason to call our clinic, because that should not happen. That usually means that you've done a little bit too much activity and your body's telling you that you need to slow down, and remember that you just had some surgery. Another question that's frequently asked is, will it hurt when my drain comes out? Well, most patients state that it feels more like a burning sensation than an actual pain. However, I recommend that you pre-medicate yourself either with Tylenol or Motrin, or possibly the pain medication that was prescribed for you by your physician. Another question is, when do I get my drains removed? Now, depending on how many drains you have, they all will put out fluid at a different volume. But we ask that you call the clinic when the output for one or all of the drains is less than 30 milliliters in a 24-hour period. We will book you into the clinic at the next available slot to have this drain removed, and remember that you will just be seeing a nurse at this particular appointment. Again, if you have several drains, you may choose to wait until they're all less than 30 milliliters before you have them removed, or you may choose to come in individually for each drain and have them removed. Whatever way is more convenient for you is fine with us. Another question would be the wound care for the JP site. We recommend that you use peroxide and water on a Q-tip and do this daily around the exit site of where the drain comes out of your body. There's no need to do any cleansing of the tube or the bulb. It is a sterile system, so just keeping the cap on, squeezing the bulb, that will be sufficient. Another question might be, what would the exit wound look like where the JP drain comes out? It actually isn't much larger than an eraser tip. The tubing of the drain is a little smaller than that. However, it is very pliable. The doctors put a stitch around that and plus anchor that into your skin with the suture, so it may even be smaller than an eraser head. I hope that you found this information on postoperative care of JP drains helpful. If for any reason you viewed this video and you still have questions remaining, please feel free to call our clinic at the number provided to you inside your H&P folder. One of the nurses would be glad to help you with any questions that you may have. Thank you very much.